Here is a super helpful tip that can be a game changer when it comes to constipation or incomplete emptying when you are having a bowel movement. So this is a strategy called belly big, belly hard that uses your breath and the pressure that's created inside of your body, and it is paired with bulging or bearing down, which is just simply that kind of push aspect of your pelvic floor. So we pair these things together, the breath, the intra-abdominal pressure, and a little bit of bulging. And this can really help facilitate a great poop for you. So let's talk about it. Let's talk about how to do it, and let's get into it. So for belly big, belly hard, what you are going to do as you're sitting on the toilet, especially if you have a squatty potty, your feet will be propped up onto your squatty potty or up onto your step stool if you have that instead at home. You're gonna put your hands on your tummy. You are going to take a deep breath in and fill your tummy with air. So I'm going to explain it. I'm going to kind of demonstrate it here. So I'm going to breathe in, fill up my tummy with air, and then I'm going to think about, can I funnel this pressure that's filled up into my tummy downward, and while keeping that tummy big and hard, I am going to push with my pelvic floor muscles. So as I'm keeping my belly big and belly hard, I'm gonna push. So I'm gonna push. And then I'm also going to breathe out a little bit of an exhale as everything is pushing and coming out. So this can be a great strategy to really help use that intra-abdominal pressure to help facilitate the stool to come out. Oftentimes, you'd be surprised, but oftentimes people really don't know how to bear down or to bulge appropriately, and this is something that we can talk about as well. One of my favorite strategies to really know if you're bulging or bearing down appropriately is to take your hand, go right underneath your bottom. I'm going to show it with the model here. So if you think about, if you know where your sit bone is, you will find your sit bone. If you don't know where your sit bone is, no worries, I will teach it to you how to find it. So what you're gonna do is take your hand, you're gonna kind of reach underneath your butt cheek, essentially, your bottom, one side. You're gonna kind of go towards the middle and kind of close to where your upper thigh meets your bottom, not quite that far down, but you should feel a hard, bony prominence there. So if you're looking at the model here, and I'm gonna turn them all this way towards the camera, this bone right here. So if you are sitting, you're gonna take your hand underneath your butt cheek and find that bone. Then, once you find that bone, you're gonna actually, I'm gonna keep this here, you're gonna kind of go a little bit, kind of cup underneath it and go a little bit more towards the middle of your body. So if you see here, my fingers with a female anatomy model, my fingers are close to where the vagina, the vaginal opening is, and where the anus is. So there's kind of the space in between the bone and between these openings right here. So if you are a male, your fingers are going to be kind of close to your perineum or close to your anus. So what you're gonna do right here, you're gonna kind of find that soft spot past the bone, and then you're gonna try to push. So I'm gonna do it now. So I'm pushing down, and you should feel a little bit of a descent, a little bit of a push into your fingers. So pair that with the breathing, keeping your belly big and belly hard, and this can be a great strategy for you to be able to have better poops. Let us know if you have any questions.